We're here to talk to you about your sexual self, both your physical and psychological selves, putting a focus on oneself as a sexual being. I'll first define the sexual self before we get started. Simply put, it is the evaluation of one's own sexual feelings and behaviors, or it is what you bring of yourself both emotionally and physically to sex and relationship. Moving on, throughout the discussion, you'll be able to trace the historical perspective of human sexuality, explain the different concepts related to human sexuality, determine the factors that affects human sexual self, and emphasize the importance of sex education. The ideas or the key concept of the topics are as follows. Human social behavior, a behavior that influences or is influenced by other members of the same groups. It is the tendency for humans to look to others for clues on how to act in a situation, like kahit alam or may idea na tayo sa isang bagay o sa dapat gawin ay bumabase at sumusunod pa din tayo sa kung ano ang gagawin ng iba. Human sexual response, it has cycles including desire, arousal, pursuit, orgasm, and resolution. This phase will be explained more later. And sexual orientation, or who you're attracted to and who you feel drawn to romantically, emotionally, and sexually, wherein physical, psychological, and cultural are the factors that we'll consider in discussing these sexual orientations and gender. Going to our first topic, historical perspective of human sexuality. Given here is the anthropological approach. The basic concept here is culture such as learned behavior and socially transmitted behavior, wherein it allows us to see how gender and sexuality views change over time, allow us to trace our current behaviors back to the past. Ancient Greece, in this period, they labeled man as a masculine, but the question is, what makes a man masculine? A man was traditionally viewed as a person who embodied strength, courage, independence, leadership, and assertiveness. And this is the characteristic that reflects man to be entitled as masculine. Dominant means they are the one who takes control over their societies or government, as man is the most powerful and influential in this time. Symbol or fertility. They are the one who has the ability to reproduce offspring, while women were referred to as feminine because of their grace, gentleness, empathy, humility, and sensitivity. During this time, however, they believed that women are weak and should be treated only as a possession. They are the one who are under man's control, limiting their rights and making it impossible for them to own property. The only purpose of a woman for them is to live roles. One must have a kid and to be a mother. But perhaps during this time they realized that the system was too much for them to handle and decided to fight for what women deserve. This is when the woman empowerment movement appears, with the aim of achieving equality from both rights and society, as well as advocating that no single gender should dominate another. The Middle Ages are the era when churches emerged. During this time, the church was the most powerful and most influential. As given here, they define church as corrupt, irresponsible, and using their power to dominate and influence people. Ay naika-question nyo na bakit ang pangit ng pagkaka-define ng church before. The truth is, those time kasi is yung mga taong simbahan ay tinitake advantage yung pagiging influential nila sa tao. In order to increase revenue, the church has begun the practice of selling indulgences. Indulgences is a document or certificate that is from a church that was supposed to lessen a person's time in purgatory and help them to get to heaven faster. Pero, paniniwalaan nyo ba na people should be able to buy their way into heaven? It sounds irrational, right? But in this era, those who has the power can easily manipulate the mind of those who are weak, and by that, the churches have become rife with corruption and scandal. Another belief being stated is that the creed that all sexual acts that do not lead to procreation were considered as evil. So, ibig sabihin nito ay any act na hindi tumutukoy sa pagre-reproduce ng offspring or panganganak ay kinukonsider as an act of evil. It just basically mean na kasalanan if you tend to do sexual activities without the label of being married, or in some circumstances ay hindi din katanggap-tanggap yung two actions na naka-flash screen, which is kissing and holding hands. Wherein in this time, women were labeled as temptress, which they pertain to Eve, and woman of virtue representing Mary or saintly. Temptress is a woman who set out to allure or seduce someone, and woman of virtue is a woman with discipline that no price can be placed on her. Mental disorder. In this time, they believe that someone who is having a mental disorder is summoned by evil. Witchcraft practices like calling a spirit and using magic spells are evil too. Those suspected of having a mental disorder or being a witch were sentenced to death, of course, by the order of church.
Protestant Reformation of the 16th century. Let's talk first about the Protestantism during this time. It is a movement against the Catholic churches. The idea that individual Christians should depend less on the Catholic Church, its Pope, and its priests for spiritual guidance and salvation has generally been at the center of criticisms of the Catholic Church. Instead, Protestants held that individuals should be independent in their relationship with God, take full control of their faith, and seek spiritual guidance directly from the Bible, the Christian sacred book. Second is, they believe that sexuality is a natural part of life and priests should be able to marry or have their own family. The Reformation ended the obligation that priests, nuns, and monks be unmarried and promote marriage as the ideal relationship for both sexes. Women could no longer become nuns, and marriage came to be viewed as the only appropriate vocation for a woman, while men could still pursue careers as priests. In this time, Protestants believe in normalizing sexual orientations, and sexual intimacy strengthens the bond between the couples. Let's move on to historical perspective of human sexuality in 17th to 18th century. Puritans rallied for a religious, moral, and societal reformation. They were the first to declare that sexual activity was essential for reproduction and that it was an also important factor of a loving relationship. They believed that premarital sex was considered immoral because they viewed sex within marriage as a gift of God and as an essential, enjoyable part of marriage. They quoted, "Sexual acts of marriage is considered a sin." During Victorian in 1837 to 1901, homosexuality and prostitution are considered threat to social order. Freud's analytical theory became famous, wherein people became curious with their sexual drives. Freud thought that all people were bisexual, which mainly meant that they possessed traits from both sexes and were attracted to people of both sexes sexually. He believed that this was accurate anatomically, which implied that it was also accurate emotionally and psychologically. Victorian believed that women should not enjoy sexual activities as it is considered as abnormal or disorder, and a man who ejaculated more than once a month gets weaker.
Biological perspective. Erogenous zones. It refers to the parts of the body that are primarily receptive and increase sexual arousal when touched in a sexual manners. So when we say erogenous zones, these are body parts where we feel aroused, or in our generation's word, this is where we feel turned on sexually. So as stated in our presentation, those body parts are mouth, breasts, anus, and genitals. So the other common areas may be neck, thighs, abdomen, and feet. So we have here two Classifications of sex characteristics. The first one is the primary sex characteristics. It refers to sexual organs present at birth and directly involved in reproduction. For example, for men, these are testes and penis. For penis. For women, these are ovary and vagina. So the second one is the secondary sex characteristics. These are sexual organs and traits that develop at puberty and are indirectly involved in human reproduction. So these are changes during our puberty stage. So for male, voice becomes lower, hair growth on chest, face, underarms, legs and pubic area, increase in muscle size, skin becomes oily and pores enlarge. So in female, their breasts enlarge, hair growth on underarms and pubic area, hip widens, skin becomes oily and pores enlarge. Evolutionary perspective. Beauty is more than just a cultural standards or cultural standards. It is primarily an evolutionary standard for attracting the best partner. But aside from attracting a partner, it also have a survival advantage. So male with broad shoulders, instantly for genetic survival, physically healthy. Female with large breasts, for nutrition, so child can survive.
Libido is the term commonly used to describe sexual drive. It is an instinct or erotic desire and pleasure. One example of this is the urge to have or to engage into sex. Here are some factors influencing libido. Hormones. The loss of estrogen and testosterone hormones leads to changes in woman's body and sexual desire. Relationship. If a couple is having a problem, their sex life may be affected. And also, some medical conditions can affect the sexual desire or sexual drive. Gender. It talks about how the society thinks we should act and do. It is the characteristics of men and women that is socially constructed. When we say socially constructed, it is an idea that has been created and accepted by the society that includes being masculine and feminine. Gender roles. Gender roles are the standards set by the society as to how an individual should act based on the sex they are assigned with. For example, women are always assigned to do household chores because they are entitled as housemakers, where in fact, those are just basic life skills that we all need, especially when we live on our own or become independent. And as for men, they are always expected to be the protector and the provider. They cannot show emotions, they cannot be emotional, because that's what the society says. Gender roles really have a huge impact in human behavior, including the clothing we wear, the profession we pursue, and the relationship we enter. Now, since gender is based on what the society thinks about you, gender identity pertains to what you think about yourself, what you feel about yourself. It is our personal sense of self. It considers what do you want or who do you want to be, whether you're a man, a woman, neither, or both.
So, ayun naman po sa human sexual naman po ay kung hindi nyo po napapansin ay may iba't ibang stages po tayo dyan. Unang-una po is yung desire phase. So, sa desire phase po, kumwari kasama nyo po yung boyfriend nyo and then, kumwari bumulong siya sa'yo na humingi siya ng kiss. And then, your response na yes, edi magkikiss kayo. And then, after you kissing na, mag-iisip kayo na iba pa. Kasi hindi lang naman yun yung gusto nyong gawin. Na kumwari, gusto nyong higitan pa yung ginagawa nyo kasi nga curious kayo. So, and then, dun papasok yung mga fantasies sa utak nyo na yun nga, yung hindi lang yun yung gusto nyong gawin and then, gusto nyo pang mahigitin. And that's what you call desire phase. So, next naman is yung arousal stage. So, dito po yung sexual pleasure na yung lalaki ay nakakaramdam na yun, ng pagnanasa sa'yo. And then, dun naman sa babae, sabi dito na kapag ang babae nakakaramdam ay tumitigas daw po yung nipple. And then, ang sunod naman po natin is yung flaccid phase. At ito naman ay sumusunod sa excitement or sa sexual arousal phase. So, katulad ng, syempre, habang ginagawa nyo yun, hindi lang naman kayong basta nag-kiss. And then, syempre, meron doon na tumitibok yung puso nyo. And then, yung pagtaas ng kasiyahan sa sexual at pagtaas ng tension. Syempre, may nagkaka-tension na kayo habang nagaganon kasi syempre, dala ng kasiyahan, nagkakaroon kayo ng tension at sinusundan ito ng orgasm. So next naman po natin yung orgasm phase. So dito po is yung ayun na po, yung sinasagawa nyo na yung gusto nyo gawin, kayong dalawa mag-partner. And then, the next one is resolution phase. This is particularly in men. So, syempre, pagtapos nyo sa ginagawa nyo sexual, ay magbabawas ang lalaki ng kung ang tinatawag ay semilya. So, these are the differences between these three. So, yung human abnormal, human sexual response is lack of sexual desire. Or kung tatawagin ay interest ka sa sex. And then next is sexual dysfunction. Ito naman ay yung performance. Yung ginagawa nyo na. And then the last one is yung paraphilic disorder. So dito is yung sexual attraction to unusual object or activity.
Sexual dysfunction ay isang problema na maaaring mangyari sa anumang yugto ng siklo ng pagtugon sa sexual. Ito yung pinipigilan ka nitong makaramdam o makaranas ng kasiyahan mula sa sexual na aktibidad. We have 4 categories of sexual dysfunction. First is desire disorder. Ito yung tinatawag nating libido kasi bumababa na yung interest niya sa sexual activities. Maaaring yung rason ay stress, depressed o kaya relationship issues. Katulad sa mag-asawa, kung lagi na lang sila nag-aaway o lagi silang busy sa trabaho, nawawala na sila ng interest sa sexual activities. Kaya bumababa na yung interest nila. 2 is arousal disorders. Arousal disorders, ito naman yung mga babaeng hindi na interesado sa pagkikipagtalik at hindi na nagre-respond ang subjective o physical to sexual stimulation. Ang pababa ng interest and ability to be sexually aroused. Ito yung yung mga babae meron na edad o kaya matagal na yung relasyon nila. Kaya bumababa na yung interest nila sa sexual activity. Katulad ng mag-asawa. Sa una, pagbago pa lang sila, active yung sexual activity nila. Pero, pag matagal na yung relasyon nila, medyo bumababa na yung pagkawalan nila ng interest sa pagkikipagtalik. Orgasm disorder. Ito yung kawalan ng kakayahan na makamit ang orgasm sa anumang sitwasyon. Kahit anong gawin mo, hindi ka na lalabasan ng orgasm. Babae o lalaki, meron yan orgasm. Pain disorders. Women can experience pain during or after sex. It's either in the vagina or deeper in the pelvis. Ang pananakit sa ari ay maring sanhi ng infeksyon na nakukuha sa pakikipagtalik gaya ng chlamydia, gonorrhea, o genital herpes. Katulad ng menopause, nagbabago na ang menopause ng babae. Nagbabago na ang hormones, kaya natutuyuan na yung ari nila. Kaya pag yung ari nila natutuyuan na, kaya nakakaramdam sila ng sakit pag nakikipagtalik sila. Kasi dry na yung nila yung ari nila. Primitive early ejaculation. Ito naman yung kadalasan na nangyayari na early ejaculation sa mga lalaking mas bata pa. Kasi napaagang bulalas ay nangyayari kapag ang isang lalaki ay may orgasm at naglalabas ng mas maaga sa panahon ng pakikipagtalik kaysa sa gusto niya o ng kanyang partner. Delayed ejaculation. Delayed ejaculation, ito naman yung kadalasan na nangyayari sa mga matandang lalaki na. Kasi delayed ejaculation including chronic health condition and physical and psychological problems. When we say psychological problems, meron silang trauma o kaya may mental health disorder katulad ng anxiety, depressed sila, and religious or cultural teachings leading to negative connotation about sexual intercourse. Erectile disorder. Failure to obtain or maintain erection during partnered sexual activities. Ito naman yung kabiguang makakuha o mapanatili ang paninigas sa panahon ng kasasyong mga aktibidad sa sexual. Kadalasan ito nangyayari sa mga matanda na lalaki. Pag nakikipagtalik sila, hindi na nila na napapanatili na matigas yung ari nila. Female orgasmic disorder. Maaring hindi magkaroon ng orgasm ng mga babae kung masyadong maagang natapos yung lovemaking nila o kaya hindi maayos yung foreplay nila ng partner niya, kaya hindi sila nalalabasan ng orgasm. Male hyperactive sexual desire disorder. Ito naman ay nangyayari sa mga lalaking 16 to 44 years old. Ang mababang sexual na pagnanais ay humigit kumulang 15% to 17% ng mga lalaki. Ang mga matandang lalaki, ito yung madalas na nakakaranas ng mababang pagnanais sa sexual activities kasi matanda na sila eh. Unlike sa mga mas bata pa na lalaki, active pa sila sa sexual activities.
Paraphilic disorder is derived from the word philia, which means strong attraction or liking, and para, which means abnormal. Intense and persistent sexual interest other than sexual interest in genital stimulation or preparatory fondling with normal, physically mature, consenting human partners. According to American Psychiatric Association, paraphilic disorder are often misunderstood as a catch-all definition for any unusual sexual behavior, like manyak, bastos, or malibog. However, paraphilic disorder is found to be an illness caused by many factors such as personal distress, sexual desire or behavior, society's disapproval about their gender identity, anxiety, and trauma. The person under paraphilic disorder has the ability to harm others and be inconsistent and persistent into any unusual sexual intercourse. There are some paraphilic disorder. First one is exhibitionistic paraphilic disorder. Exposure of genital to unaware person showing genitals to public. Or ito yung nagpapakita ng ari sa isang taong walang kamalay-malay. It's either public or in private. The second one is voyeuristic paraphilic disorder. Observing or watching an aware naked person. Ito yung mga tinatawag na naninilip or nanunubok sa mga butas, lalo na kapag nalalaman nilang hubad yung isang tao. or sila yung mga taong binabantayan kung kailan ito mga naguhubad. The third one is voyeuristic paraphilic disorder, touching or rubbing genitals against an aware person. Mga tao nang hihipo ng dadakma or nagpapadama na kanila mga ari bigla-bigla in public or in private man. The next one is transvestic disorder, sexually aroused with a person who wear opposite dress code. It's either in bi or in normal men and women. Ito yung mga na-arouse sa mga taong iba ang suot kumpara sa kanila. Kunwari, sa mga lalaki na may paraphilic disorder, na-arouse agad sila once may nakita sila mga nakatupis. Something like that. The fifth paraphilic disorder is sexual masochism disorder, aroused by being humiliated, beaten, bounded, or experiencing suffering. Ito yung mga taong gustong-gusto ang sexual intercourse na brutal. Ang example nito ay yung mga international movie kagaya ng 50 Shades and 365 DNI or 365 Dicks. The next is sexual sadism disorder, inflicting pain psychologically or physically. Kung ang sexual masochism ay yung mga taong na-arouse kapag sila'y sinasaktan or brutal na sexual intercourse ang nagaganap, ang sexual sadism naman, sila yung mga taong na-arouse kapag nananakit. Sila yung mga brutal o sadista sa isang pagtatalik, whether na pumayag yung partner or hindi man. The next is pedophilic disorder, sexually attracted to children 13 years old or younger. The victims are called NIP. Pedophilic disorder, or the word pedophile. Cybercrime or rape ang madalas na nagagawa ng mga taong may pedophilic disorder, since sila yung mga sexual attracted sa mga minor or sa mga bata. The next is fetishistic disorder, sexually attracted to non-genital or non-living objects, almost exclusive with men. Ito yung mga taong na-arouse or nabubuhayan through sa mga gamit lang, like sex toys or kagaya ng mga nabalita noon na tirador ng panty or nangunguha ng panty para amuyin lang ito or singhot-singhotin, and doon sila na-arouse talaga or doon nagagawa yung sexual intercourse.
Okay, let's move on to another topic. The next topic is the natural and artificial method of contraception. This topic is all about the birth control and maybe family planning. The first method is the natural method. This method do not involve any chemical or foreign body introduction with the human body. People who are very conscious of their religious beliefs are more inclined to use the natural way of birth control, and others follow such natural methods because they are most cost effective. So, this method is, ito yung hindi ginagamitan ng any chemical or medication para maiwasan or makontrol yung panganganak ng isang babae. The example is the abstinence. The abstinence from sexual activities means not having any sexual intercourse at all. No sexual intercourse with a member of the opposite sex means that there is no chance that a man's sperm can fertilize a human's egg. The second method is the artificial method. The artificial method or artificial birth control can be defined as any product or procedure
or practice that uses artificial or unnatural means to prevent pregnancy. So, this method is, ito naman yung ginagamitan ng chemical or medication para makontrol yung pagbubuntis ng isang babae o yung panganganak ng isang babae. So, the first example is dito na yung nilagay ni ma'am, the artificial method in common uses include prevention from sperm from reaching the ovum by using condom or diaphragms. So, ito yung pinaka-common na ginagamit ng isang lalaki para makaiwas na mabuntis yung isang babae.
Barriers to access of contraceptives. Barriers stemming from inadequate health systems that limit access to affordable, available, quality products and services afflict many countries, particularly in the developing world where the unmet need for contraceptives is high. Yun, meron mga countries na hindi pa ganun ka-develop, na yung system nila doon is limited lang yung access sa pagbili ng mga products. And ayun, kailangan sa mga lugar na yun is kailangan yung mga contraceptives, pero dahil nga may limit yung pagbili nila, hindi sila nakakabili. In almost all situations, women, particularly adolescents, encountered many barriers to using existing services, including distant service delivery points, cost of transport, lack of knowledge about different types of methods, misinformation and misconceptions, religious opposition, cultural factors, language barriers with providers and providers biases. So, yun, yung karamihan nga po sa mga kabataan dun sa mga hindi pa ganun ka-develop ng countries is misinformed sila. Hindi nila alam kung paano gumamit ng method. And syempre may mga religion sila dun na hindi naniniwala sa ganung methods. And then, sa culture din nila. Lack of contraception can be particularly damaging to teenage girls. According to WHO, globally, about 15 million girls aged 15 to 19 and some 1 million girls under 15 give birth every year, most in low and middle income countries. So yun, doon nga sa mga bansang yun is karamihan nga ng mga kabataan is nabubuntis. And hindi sila marunong gumamit ng mga contraceptives. So, every year, may mga 15 to 19 years old na 15 million girls age 15 to 19 na nabubuntis and nanganak every year. Complications during pregnancy and childbirth are the second leading cause of death for 15 to 19 years old girls globally. Every year, some 3 million girls 15 to 19 undergo unsafe abortions. Babies born to adolescent mothers face a substantially higher risk of dying than those born to women age 20 to 24. So, ayun, sa mga batang daw po na nabubuntis na yun is nagkakaroon sila ng complications during their pregnancy and nauwi ngayon sa pagkamatay. At saka meron daw din pong mga kabataan na nagpapa-abort na hindi safe. Nagpapa-abort sila siguro dahil takot sila or hindi pa sila ready and hindi nila kayang buhayin yung bata. Kaya ayun, nagpapa-abort sila kahit na hindi siya safe. Sexually transmitted disease, also called as STD, are infections transmitted from an infected person to an uninfected person through sexual contact. But take note, ang makakakuha lang nito is anyone who is sexually active or someone who has interaction with person who is already infected by the bacteria or viruses. Brief skin-to-skin contact is all that's needed to pass the virus.
first on the list is chlamydia. It affects both men and women. It can cause permanent damage to a woman's reproductive system or organ. So dito, yung isang babae is mahihirapan na magkaanak, and worse, it can cause ectopic pregnancy. So when we say ectopic pregnancy, it is a pregnancy occurs outside the woman's womb. So syempre magtataka kayo kung paano ka nga ba mai-infect ng chlamydia. So it can affect you through sexual contact. It can be vaginal, anal, and oral sex. So, syempre may symptoms. So, symptoms can occur within 2 to 14 days after infection. So, pwedeng umabot ng months, years before mo malaman na infected ka na. So, it is much better to consult your doctor. So, the question is, can we cure chlamydia? The answer is yes. We just need to use antibiotics, and once we are tested as negative, chlamydia is gone or it is already cured.
Gonorrhea. Ito yung infection caused by sexual transmitted disease, which is STD. Kumbaga, ito yung bacteria na kapag ka nakipag-sex ka sa kapwa mo lalaki or sa kapwa mo babae, pwede mo tong makuha tong bacteria na to. And then sa babae, pwedeng maapektuhan sa'yo yung cervix mo, and then yung urethra, and then yung throat. Same din sa lalaki. At sa lalaki naman ay maapektuhan ng kanilang rectum. At kapag ka nakipag-sex kayo sa kapwa nyo lalaki, and then sa anal kayo pwede yung maapektuhan. Dun kayo magkakaroon ng gonorrhea. Yun yung infection nyo kapag nag-sex kayo sa anal. Also sa babae din. So, ayun.
Syphilis is a bacterial infection usually spread by sexual contact. You can get syphilis by direct contact with a syphilis sore during vaginal, anal, or oral sex. Hindi ka mahahawaan ng syphilis sa toilet seats, bathtubs, swimming pools, pag-share ng damit or utensils sa isang taong may sakit na ito. Mayroong 4 stages ng syphilis. Every stage has different signs and symptoms. Sa primary stage ay sasakit pa lamang yung part kung saan pumasok ang syphilis sa katawan ng isang tao. It usually occurs in sexual parts like vagina, penis, anus, or even in lips and mouth. Sa secondary stage, mayroong lumalabas na red, reddish-brown at rough rashes na makikita sa palad o sa ilalim ng paa. The latent stage of syphilis is a period when there are no visible signs or symptoms. Without treatment, you can continue to have syphilis in your body for years. Most people with untreated syphilis do not develop tertiary syphilis, pero pwedeng ikamatay ito kapag hindi agad naagapan dahil dinadamage nito ang internal organs ng isang tao. Syphilis is curable with the right antibiotics from your healthcare provider. However, treatment may not undo any damage an infection can cause.
The number 4 of the sexual transmitted disease is the chancroid. In my research, the causes of chancroid is a very contagious bacteria disease spread by sexual contact. The bacterium that causes chancroid is called Haemophilus ducreyi. So, ito yung may mga signs siya and symptom na makikita kapag mayroon kang chancroid. Ito, painful and draining open sores in the genital area. So, ito yung alam niyo na ba yung nakakita na kayo ng singaw dito? Nakakita na kayo ng singaw. Parang ganun yung mukha niya or yung mga bulutong tubig, ganun. Maliliit lang, ganun siya. So, ito yung masakit siya and namamaga, ganun, then nagdrain siya. Yun yung mukha niya.
Human papillomavirus, or HPV for short, is a common sexually transmitted infection that affects human of all genders worldwide. These are a group of non-enveloped DNA viruses that infects human epithelial cells. HPV in particular can cause warts, and several genotypes of these viruses are associated with a certain type of cancer. You can get HPV by having vaginal, anal, and oral sex with someone who has the virus. It also spreads through skin-to-skin contact during sex.
Herpes simplex virus. Ang virus daw po na ito ay nakukuha sa sexual intercourse and kissing. Makakamta kapag yung isang nakatalik po ay infected ng sakit na ito. And itong virus na daw po ito is very contagious that can cause infection sa ating private parts. And ang virus na po ito ay panghabang buhay na. And daw nawawala po siya pero bumabalik din siya kapag ikaw ay pagod, stress, may lagnat at may allergy sa skin. And ayun nga lang, dahil may gamot naman na tinitake, panghabang buhay na nga lang po ito. At wala siyang cure.
The seventh sexually transmitted disease, or STD, is Trichomonas vaginalis. Trichomoniasis is caused by one-celled protozoa, a type of tiny parasite called Trichomonas vaginalis. Pagdating sa lalaki, wala ka makikitang symptoms kung meron na ba siya nito or wala. Pero sa babae, ang 3 biggest symptoms na maaari nating maging guide para ma-distinguish kung meron tayo ng STD ito is yung pagkakaroon ng amoy ng ari or masangsang na amoy sa ari, pangangati ng ari, pagsakit or pangingirot ng ari. Ang isa din sa pwede maging epekto nito kapag nagkaroon ka ng STD Trichomonas vaginalis is yung pagkakaroon ng premature baby or panganganak ng wala sa kaorasan, wala sa kabuwanan or kulang.
Common mates among STDs. Life sentence transmitted through hugging and kissing. It only happens among homosexuals. STDs are infections that are spread from one person to another person, usually during vaginal, anal, and oral sex. We have 3 common mates among STDs. First is gonorrhea. Gonorrhea is meron tayong dalawang klase ng gonorrhea. First is gonococcal and non-gonococcal. Gonococcal it is yellowish. Medyo aktibo yan. Non-gonococcal, yan yung whitish. 2 is chlamydia. Hindi lahat meron sintomas pero makaka-experience ka ng pananakit sa pag-ihi o kaya makakaramdam ka ng sakit habang nagkikipagtalik ka, abdominal pain. Yan ay mga mararanasan mo pag mayroon kang chlamydia. HPV. This is symptoms. This is infection ay nagpapakita ng walang mga sintomas, at some people may experience warts on the genitals, mouth, or lalamunan. Ang ilang uri ng HPV ay maring humantong ng cancer tulad ng cervical o oral cancer. STDs, ito yung kadalasan daw nangyayari sa mga homosexual. Pag nakikipag-sex sila sa lalaki to lalaki,